So 80405 has had some impact. The manuscript is in press, so that'll be out relatively soon on the primary study. The biggest difference in terms of the guidelines or patient management has been the observation about sidedness. Again, our findings really convincing that right-sided colon cancer patients get no benefit from the EGFR antibodies. And now really 7 subsequent publications or series that show the same thing in different settings, first, second, multiple lines of treatment. Our study only looked at first line, and you could argue maybe the data isn't as strong for subsequent line treatment. But the guidelines have changed in that we at least recommend in first line that only patients only patients who do not have right-sided primary should be considered for EGFR antibodies. Where that will go henceforth, I don't know. I think it may very well be that any patient with a right-sided cancer should not get an EGFR antibody during the course of their therapy, but that's not up for me to say. But as you look at the sum of the data, it's pretty compelling, and it's consistently the case. In every study, it's shown the same finding. Now, it would be nice if we could explain the sidedness, because I don't think it's magical, right versus left. And at ASCO coming up, we will have 4 abstracts looking at the consensus molecular subtypes and a variety of other factors that I think will lend some clarity that it's not only sidedness, but it's a subset of patients based on the non-random distribution of these subtypes of cancer throughout the colon. So I'm hoping after ASCO in June, we'll have a pretty good idea of who to treat and how to treat them. It won't be ironclad, but it should be pretty close.